My name is Dr. Hillel Mazansky, and I specialize in medical hypnosis, guided imagery, nutrition, and exercise. My website being drmedicalhypnosis.com. Doctor is drmedicalhypnosis.com. Today I'm going to discuss colon cancer. Colon cancer is the third most common occurring cancer in the United States, and it has the second highest mortality rate out of all cancers. While it occurs in people over the age of 50 usually, young people of the age of 20 and 30 have developed colon cancer and have even died. Now, when one has colon cancer, what are the predisposing factors? First of all, there's age, which you can do precious little about. 50 and over, you're more prone to it. Family history. Oftentimes there's a family history of colon cancer, and then there's a greater chance that you can develop the same thing. If there's a family history of breast or ovarian cancer, then there's a greater chance of an individual in that family developing colon cancer. Now, those are unpreventable facts that are as they are. However, there are certain factors that predispose to colon cancer that you can help prevent yourself, and that is weight. Do not become overweight. Obesity is a factor. Not exercising. Huge predisposing factor of being overweight, greater chance of developing colon cancer. Taking in a high diet consisting of deli foods, those foods have nitrosamines which are dangerous and can help develop colon cancer. How does this actually develop? The cancer begins as a small polyp, which is usually a small little swelling on the inside of the bowel. Now, there are two types of adenomas. There are two types of polyps, the adenomatous type and the hyperplastic type. The hyperplastic type is completely benign and will never change. However, it is the adenomatous type that can undergo change. The cells in the division start changing and the cancer develops. The warning signs of colon cancer, to start off with, are initially there's no signs at all. Then you might notice when you go to the bathroom there's some blood in your stool. The next is heavy rectal bleeding, abdominal pain, and weight loss. And by that time, it is usually far. The colon cancer is divided into various stages, depending where it's located and if it's spread or not. It is important to do screening to prevent colon cancer, especially if there's a family history of colon cancer, breast, ovarian cancer, and if a person is overweight and doesn't exercise. It is recommended that you do what is called a colonoscopy. This is a large tube with a camera on the end, and it goes up the rectum and follows the entire large bowel or colon, checking for polyps or tumors. If such is found, a biopsy is taken and the diagnosis is made. What is the treatment? The treatment initially is surgery. Depending on how bad it is, sometimes the whole colon can be removed. Radiation and chemotherapy. Now, the chemotherapy can make you extremely ill with nausea and vomiting. And it is here that hypnosis comes in, because patients who use hypnosis while having the chemotherapy decrease their chances of feeling nauseated and vomit. Once you have been given the diagnosis of colon cancer, you can have the surgery, radiation, chemotherapy. But then you can empower yourself to assist yourself in your own treatment by using medical hypnotherapy for cancer. We empower you to visualize yourself assisting with a treatment, a highly nutritious program, and an exercise program especially. We also check your vitamin D level to make sure that the level is not low, because oftentimes a low vitamin D level might be associated with colon cancer. So here, in this case, like everywhere else, prevention is better than cure. To prevent it, if there's a family history, get screening regularly, remain lean, don't be overweight, exercise, have your vitamin D level checked, eat the correct nutritious foods, and you will be fine. There's no chance, no, I wouldn't say no chance, but your chances are decreased of developing colon cancer. My name is Dr. Hillel Mazansky, and I thank you for listening to this health tip.